Assalamu alaikum. Sorry about this delay. There was just a problem with the break. So let us start. Start early and stay ahead with TALTs.
Welcome and thank you for dedicating your time to attend this meeting. At Lilly, we are committed to following the letter and the spirit of laws, regulations, policies, and procedures that govern the pharmaceutical industry. We would like to remind you that today's discussion will be dedicated only to information that is consistent with the product label approved in our country. Any questions related to unapproved drugs or indications, dosing regimens, populations, or other information not consistent with the PI will not be answered in this meeting, but forwarded to our medical department. Thank you for your understanding, and we wish you a good meeting.
So these are my disclosures. So psoriasis is not a skin-deep disease. It is causing a lot of a negative toll on the whole patient, emotionally, psychologically, and it affects the whole person as a whole, the skin and the psyche. So the burden itself of psoriasis is an unmet need. So therefore, the patient have a high level of goals. They want to achieve a high level of these goals. They want complete skin clearance, but they don't want only just complete skin clearance, they want it fast. They want rapid skin clearance. Also, they want the skin clearance to be long-term. They don't want relapse from these medications. They also want confidence in their treatment. They want it to be a safe medication. And they want it to treat the hard-to-treat areas like the scalp and nails. So if we have this burden addressed and these goals addressed, we will have an improved in the quality of life. The whole patient's life will be improved and changed. So can we actually achieve complete skin clearance with TALTs? Yes. By the 12th week, around 40% of the patients will achieve a PASI 100 score. So now we have achieved the goals of complete skin clearance, quick clearance, and confidence in their treatment. Also, this complete clearance has extended up to 12 weeks, 12 months. So the patient, 46% achieved a PASI 100, that is complete skin clearance. 46% of them achieved it by the first year. So this patient will achieve the goals of long-term clearance and confidence in their treatment. Now, this PASI 100 shows durability. What does durability mean? It means that there's a rapid improvement from baseline to 12 weeks that is maintained up to 12 months and also maintained up to 24 months, 2 years. This is from the SOHO trial, the Psoriasis of Health Outcomes trials. So it shows that the PASI score is maintained all across the months. So also the PASI 100 is maintained up to 5 years. 67% of the patients achieved a PASI 100 up to 5 years. This is according to the UNCOVER 3 trial. So let us compare TALTs with guselkumab through the IXORA-R trial. Let's compare the PASI 100 and the DLQI 0 to 1. The PASI 100, there's 55 days more free of psoriasis with TALTs compared to guselkumab. And according to the DLQI of 0-1, that is clear or almost clear, there is 84.9 days more or less DLQI with TALTs compared to guselkumab. Also, TALTs shows a rapid PASI 100 up to 12 weeks. So let us decipher this graph. By the 4th week, 7% of the patient achieved a rapid PASI 100 on TALTs, whilst guselkumab only 1% by the 4th week. Coming to the 8th week, 30% of the patient had a rapid PASI 100 score, compared to 14%. And by the 12th week, 41% of the patients achieved a rapid PASI 100 response at the 12th week compared to 25 with guselkumab. Now, also, TALS shows complete nail clearance. 63% of the patient showed by 24 months, that is 2 years, 63% showed a complete clearance of their nail psoriasis, whilst guselkumab was only 44% by the 24 week. So why is it important to treat psoriasis early? As we all know that eventually a patient with psoriasis within 10 years, eventually they're going to develop psoriatic arthritis. And patients with nail psoriasis and scalp psoriasis are more prone and have a higher risk of developing psoriatic arthritis. Not only that, patients with nail psoriasis have a 3 times greater times, they're more prone to develop psoriatic arthritis. They found that patients that were not treated with biologics, 26% eventually will enter into psoriatic arthritis, while only 1.9% of the patients treated by an interleukin-17 will develop psoriatic arthritis. 1.9% will develop psoriatic arthritis with interleukin-17 compared to 6.1% on a interleukin-23. Now, once psoriatic arthritis develops, it is irreversible. So we have to start early treatment with a biologic in order to save the patient from the side effects or the disability of psoriatic arthritis. There is pain, there is mutilation in the joints, there is dactylitis, there is enthesitis, there is sausage fingers, and once these side effects, or I call them the manifestations of psoriatic arthritis are there, it is not reversible. The pain sometimes can be reversed with some biologics, but not the long-term effects. So can the patients have complete clearance of their scalps and nails also with TALS? The scalp, at 74% of the patients on TALS by week 12 will eventually have a complete skin clearance of the scalp and the nails by 12 weeks. And also by 12 weeks, 67% will have complete nail clearance by week 12. So now we check the list of the scalp and nail clearance. Let's compare now the 5 years, 12 weeks and 5 years. The scalp psoriasis at 12 weeks, 76% of the patients have a PSSI of 0. The PSSI, like the PASI score for the skin, we have the PSSI for the scalp, which is the Psoriasis Severity Scale Index. 76% of the patients with scalp psoriasis at week 12 will have clearance of their scalp. And at 5 years, 87% of the patients will have a PSSI 0 at 5 years. Now, coming to the nails, there's the NAPSI score. The NAPSI score is the Nail Area Psoriasis Index. 18% of the patients at 12 weeks will have clear nails, and 77% at 5 years will have nail NAPSI 0. Now, as we know, biologics by time, they lose efficacy. The patients eventually will relapse or lose efficacy. But as you see these scores, at week 12, let's compare the scalp. It was 76% and became 87 at 5 years. The nails, it was 18%. At 12 weeks, it improved up to 77% by 5 years. So it is not just losing efficacy, otherwise it is improving and increasing in efficacy. So here, the patient achieved the goal of confidence in their treatment because it's a safe and gave them durability and long-term maintenance, and the scalp and nail, which is a difficult to treat area, was addressed. So now I want you to meet one of my patients, but I'd urge you, please, I have consent to present the case, but I don't have consent for you to take photos. So please, I apologize for any photos of the patient. So this patient, he is 73 years old male. He never took biologics before. He never even took a cream before. He came to the clinic. His wife actually had the appointment, and she actually tricked him to come to see me. She did the appointment for herself in order for him to be treated. She told me she's also his relative. She's his cousin and his wife. She told me, I can't remember any day that my husband had any complete skin clearance of psoriasis. Since childhood, he had psoriasis. So his psoriatic plaques, they span the neck, the back, the arms, the abdomen, the genitalia, every part of the body. He also had joint pain. He had psoriatic arthritis. He also had nail affection and hard-to-treat areas like the genitalia, the scalp, and the nails. The other comorbidities this patient had, he was hypertensive, he was osteoporotic, he was having dyslipidemia, he was pre-diabetic, and eventually he now entered into diabetes, and he was morbidly obese. And he was depressed. He was not talking through the visit. He was on a wheelchair, and he was totally refusing. And then a miracle happened, and he agreed to take photos and start a biologic. So let me share with you the before pictures of the patient. These are his pictures before TALTS. As you can see, his abdomen is fully having coalescing large plaques to the extent they show as one huge plaque. He had large plaques on the back, on the lower legs, on the scalp, and the hands. Now, the hand picture has a lot of stories to it. He was leaning his hand on the table because he could not stand up straight. He was so depressed. He was very weak and frail. He could not even stand up straight. He had to lean on the desk in order for me to take the picture. And as you can see, he has manifestations of psoriatic arthritis. He has dactylitis, he has swelling of the joints and the fingers, he has sausage-shaped fingers. So let me share with you after the first loading dose of TALTS. This is just after 2 weeks of treatment. So as you can see, the marvelous improvement after just the loading dose. This is after 2 weeks of treatment of TALTS. You can see the legs are showing marked improvement. As you can see, also the scalp showing marked improvement, total clearance. These are the hands before and after. As you can see, even though the skin manifestations on the hand have cleared, but the psoriatic lesions, the sausage-shaped finger, the swelling of the finger. So psoriatic arthritis just hit him. We cannot reverse it. But he's telling me the pain started to improve slightly. This is his arms before and after. And now I'm going to show you after 7 months of treatment. Can you see the marvelous improvement, total clearance of the skin? And he was coming, he was smiling, he was happy, he was not on the wheelchair, he was in a nursing home, he left the nursing home, he stopped his antidepressants, he was starting to wean himself off it, and he lost weight. If you can see the picture of the before and after, he was even losing weight. So as you can see also the back picture, definitely you can see the loss of weight. So this patient with TALTS treatment, he achieved all the goals we mentioned before. He had complete clearance of the skin, rapid clearance of the skin, difficult to treat areas were addressed. He gained confidence in his treatment. It changed his life. He's no longer stressed. He's no longer depressed. He's walking, he's talking, and he's smiling. And that's a big change in his personality. And all his family members were always escorting in and out of the visits. They're very happy. So let me share with you some of the safety of TALTS. TALTS demonstrated a consistent safety profile over 5 years across 400,000 patients. And the real-world safety was similar to clinical trials. There was no unexpected safety signals from the real-world data. The common adverse effects observed in real-world data were the injection site reaction, the candida, and the respiratory infections. They were similar to the clinical trials. The discontinuation due to the side effects were infrequent. There was a low risk of serious adverse events and malignant neoplasms versus other systemic psoriasis drugs. IBD was uncommon across the clinical trials of TALS, and in real-world evidence were similar among patients with versus without interleukin-17 exposure. Now, TALS, before, there was the citrate component in the injection. It was very painful when the patients were taking the injection. So now there is the citrate is removed, and the patient takes the injection. It's a very easy self-administered injection, and patients with phobia do not see the needle, which is a plus. So with TALS, patients achieve a rapid skin and complete clearance of their skin. They have a consistently maintained PASI 100, and the patient's expectation goals are fulfilled, and TALS demonstrates a safety profile. So let me share with you the last quote from a patient. She says, "Surrounded by watchful eyes no longer feels like a spotlight on my flaws. I can finally enjoy the confidence I've always wanted." Thank you very much. Okay, thank you.
Thank you.